Welcome, everyone. My name is Stephen Aquario. I'm the Executive Director of the New York State Association of Counties, and welcome to today's webinar on an innovative healthcare solution for New York's counties. Let me start with the reality we all know too well. Healthcare costs were one of the highest, if not the highest, cost drivers in county government budgets for 2026. And across the nation, certainly across New York State, employers are facing healthcare cost increases anywhere between 9 and double digits % this year in 2026. The steepest increases we've seen in nearly 15 years. For county governments operating with tight budgets and taxpayer accountability, these escalating costs are, of course, unsustainable. And that's exactly why NYSAC is sponsoring this webinar today. We are committed to doing everything possible to assist our member counties in lowering this trajectory of these expenses over the next few years. Because when counties save on healthcare costs, taxpayers benefit and county employees receive better care. Today, we're here to showcase a different approach, one that improves healthcare access, enhances employee engagement, and helps control costs. Through virtual healthcare solutions, AllyHealth is currently partnering with counties across New York State to deliver urgent care, to deliver primary care, to deliver mental health and dermatology services directly to our employees wherever they are, whenever they need it. Today, you'll hear how virtual healthcare breaks down traditional barriers to care, eliminating wait times, reducing unnecessary ER visits, and providing convenient access that employees actually use. We'll share real results from our member counties, demonstrate how these services integrate seamlessly with your existing benefits, and more importantly, show you the measurable impact on both employee wellness and your bottom line. We know you're facing tough decisions about healthcare benefits each and every day. Our goal today is to give you actionable solutions that address the challenges that you're facing right now. So let's dive in and explore how virtual healthcare can be a game changer for your county. Let me introduce our speakers here with us today. Before I do that, Jeanette Stanziano, do you have any housekeeping announcements for our participants?
Thank you, Stephen. Just to let everyone know that at any time during the broadcast, if you have a question for our panelists, please submit your question in writing via your dashboard. Simply click on the questions tab, type in your question, and we will get to your question at the end of the presentation during a brief Q&A. We also want to let you know that a PDF of the slide deck and a recording of today's panel discussion will be posted on our website, NYSAC.org, under webinars. I will also be sending it to you tomorrow via follow-up email to this webinar. Back to you, Steve.
Fantastic. Okay, let's get right to it. In no particular order here, let me introduce our speakers. The great Scott Cutia, the former Deputy Director and the wizard of all benefits in New York State, the former Deputy Director of Member Benefits at the Civil Service Employees Association, the headquarters of the largest public sector union in New York State, 30 plus years in member benefits, serving counties across this great state. Alan Ruffles, the great treasurer of Otsego County, New York, a longtime client of AllyHealth, is here with us today, as is Cecilia Schwinnard, the Cattaraugus County Human Resources Director, joining us from the Southern Tier. And of course, our facilitator, Caitlin Herwig from AllyHealth, the New York State Partnership Specialist and friend of the New York State Association of Counties. Caitlin, I'm going to turn it over to you here for the next 30 to 40 minutes. I'd like you to facilitate this discussion with our panel, and we'll take some questions after you're done with the discussion. Thank you.
Thank you so much, Stephen. I appreciate it. Good afternoon, everyone, and thank you for being here. On behalf of NYSAC, I really appreciate you guys taking the time to join us. And as you well know, across New York State, counties are dealing with many of the same challenges. It's getting harder for employees to find care. There's growing demand for mental health support. And at the same time, counties are under pressure to keep benefit costs under control. So today's conversation is meant to feel different. Rather than doing a formal presentation, we're actually going to have a peer-to-peer discussion. So you'll hear directly from HR county leaders who are already using AllyHealth. So they're going to share what issues they were trying to solve, what's gone well, what they've learned along the way. So our goal is for you guys to walk away with some practical takeaways, how employees are actually using the benefit, whether it's helping people get to care faster, how engagement is supported, and if something like this or how something like this fits into a county setting without creating extra work for HR or unexpected costs. And as you listen today, I encourage you guys to think about how these experiences may or may not apply to your own county. And like Jeanette mentioned, we'll also leave some room for questions at the end. And with that, I would like each of our panelists to be able to introduce themselves. Stephen, you did a great job at introducing them, but if there's anything else that our panelists want to say as far as their introduction, their experience, I'd love for you guys to be able to chime in. So Scott, would you mind kicking it off and just introducing yourself here for a moment?
Absolutely. Thanks, Caitlin. And Stephen, thank you for that introduction. I want to bring you on the road with me everywhere I go. That was fantastic. So as Stephen said, yes, I am Scott Futia. I recently retired from CSEA after 37 plus years with the labor union. In the last 25 or so years, I have been directly involved with health benefits. The first part of that primarily was overseeing the New York State health insurance program. And since about 2008, I was tasked with the oversight and delivery of healthcare on behalf of our local government and private sector units and locals across New York State. So I have worked, if not directly with many of you on the phone, indirectly via my staff that are assigned to different units and municipalities across the state. And I can tell you, I thoroughly enjoyed all of my years working with all of the municipalities and the counties we've always had a great working relationship. Alan can attest to that. Unlike some of the labor management issues that we faced in other arenas, when it comes to healthcare, it's vitally important that we work together to address this because we're all stakeholders in the cost and escalating costs and trying to control that. So that's sort of my introduction. I did recently retire. I have sort of moved into more of a consultative arena. And I'm still very involved with healthcare and care very deeply about your employees and you all as plan sponsors and trying to contain those escalating costs. So thank you for inviting me to join the panel today, and I look forward to having a conversation and furthering discussion. Thank you so much.
Thank you, Scott. Alan?
Yeah, I'm Alan Ruffles. I'm the treasurer here in Otsego County. I've been here since 2016. When I came in, I knew nothing about health insurance, but our office is the health plan administrator. So I will say that, as Scott stated very well, we worked well during labor negotiations, and I actually learned a lot of what I know from Scott and people he introduced me to, such as Chuck. You introduced me to Zach at some point. So it's been a great relationship, and AllyHealth has definitely been a key player in our health insurance plan as we move forward every year, which I know that we're going to talk about more, so I'm going to take anything away now. So that's me.
Thank you, Alan. And Cecilia is joining us. She's just hopping off and then hopping back on as a presenter, so she'll be with us shortly. But obviously, my name's Caitlin. I have been with AllyHealth now, guys, if you can believe it, 12 years. So been serving counties across New York State for about 10 of those 12 years as I've moved up in the company, and I'm really excited to be here with you guys today. And before we hear from our county panelists, I just want to level set on why this partnership exists and really why NYSAC is hosting this conversation. So as I had mentioned before, counties across New York are trying to manage those rising benefit costs, limited provider access, increased demand for mental health services, and lean HR teams. And the pressures are not isolated, they're shared across counties across the state. So AllyHealth is not a replacement for insurance or existing benefits. What it really does is functions as a front door and a layer of navigation that helps employees get to the right care earlier and more appropriately. At a high level, counties are using AllyHealth for, like Steve mentioned, virtual urgent care, primary care services as a first stop for non-emergency issues. Mental health access where availability, accessibility, and affordability are limited, which oftentimes is the case, and providing hands-on engagement and reporting to make sure utilization actually happens, because utilization doesn't happen by accident, folks. This is a tried and true engagement process that we've been working on specifically with counties to make sure that we're delivering those results. And the value doesn't come from any single AllyHealth service, but how all of these pieces work together to support smarter decisions for the counties. And I'm excited to, share some additional information with you guys today. So I want to go through just a few things. I do not want to bury anyone in a slide deck. I just do have a few things I want to show you guys, and then we'll really get into the core of our time together today, which is going to be hearing from our panelists. Jeanette, are you able to initiate the start of the screen share? It says I'm able to share my screen. I can start sharing my screen. I just thought, oh, there we go. Thank you. That's precisely what I was looking for. Yeah, so my intention today is just to walk you guys through a couple of things before we jump into the panel here, really to discuss what AllyHealth is, why virtual care now, and just getting into some of our discussion here with the panel.
I think we lost our slide deck there, Caitlin. Need to get that back.
Looks like it.
Just hold the line here to our attendees and we'll be back. Here we go.
Great, Jeanette, thank you. So as you can see, that's a little me on the lower left corner, and my little emoji self is going to be bringing us through our time together today. But really what AllyHealth is to solve for is going to be those access challenges. We find a lot of folks across the state, especially in rural areas, are having accessibility issues with finding primary care, finding mental health participants, rising healthcare costs. I think we are all facing that, particularly this year, but year over year, it's not going anywhere, right? So rising healthcare costs and HR capacity constraints. So we want to make sure right off the bat that we're letting you know that this is not an HR burden. This is not something to put on any of your plates. And I'm sure our folks over at Otsego and Cattaraugus can vouch for that. But really, really important that you guys understand fundamentally why we're here. You can go to that next slide, and I just want to share a quick statistic with you guys. This is one of the most impactful statistics, and what I look at as one of the reasons why this is so important. 71% of emergency room visits can be handled using virtual care. 71%. And we see that, this is an average across the country from the American Telemedicine Association. And what it means to us being in the virtual care space is that, awesome, Jeanette, that looks great, is that 71% of emergency room visits can be handled using virtual care, which means that a lot of folks are still using the emergency room for things that are not emergencies. And so at AllyHealth, we really want to change their mindset and make sure that they understand they have a $0 copay, no copays, no deductibles, point of care, point of access, where they can get that care, that issue taken care of without even considering going to the emergency room. And for a lot of you on the call right now who are self-funded, have some sort of skin in the game here. When an employee goes to the emergency room, you guys are footing that bill in a lot of these cases. So if we could redirect 71% of those emergency room visits onto a third-party platform like AllyHealth, what that cost savings might look like for each and every one of you. So that's a really powerful statistic from the ATA that I wanted to share. And it's really the one of the reasons why we're all together today, is to be able to help offset those expenses. If you can go to the very next slide. Our goal here at AllyHealth is to take the employee that's dealing with an issue and take them to the right level of care. Now, we do that through multiple vehicles here. Number one is going to be your $0 copay, virtual, urgent, and primary care. Truly, truly, truly unlimited free access to medical providers 24/7, 365 nationwide as a first stop for non-emergency needs. Cold, flu, sinus infection, pink eye, strep throat, UTI, all those nuisance issues that we don't want to have to go to an in-person provider for. But I always like to coach employees that don't let that list, the common conditions limit you. We have folks use this for, do I need stitches? Do I need to go in person? Is this burn serious enough to go seek treatment? Things that are not emergency. I always say, look, if it can wait 15 minutes, use your AllyHealth first. If it can't wait 15 minutes, maybe it is an emergency and we need to seek in-person care. But more often than not, we're able to divert those unnecessary emergency room and urgent care claims off of hitting the health plan and onto AllyHealth, which the intention here, y'all, is not only to reduce those costs today, tomorrow, in the future, but reduce that renewal increase and stabilize that. So we're not seeing those double-digit increases because we've tempered those everyday non-urgent claims. A lot of our counties across the state are also asking for mental health support, whether that be short-term crisis intervention, substance abuse counseling, addiction therapy, grief, loss, postpartum, depression, anxiety, you name it, even to psychology and psychiatry. The average wait time for a psychologist or psychiatrist in New York State ranges between 6 to 8 weeks. A lot of folks can't wait that long, and that's on the low side. A lot of times it takes a lot longer than that to find an in-person provider. So again, supporting early intervention, get folks started in care where they may not have been able to go the normal route, and redirect those behavioral health claims off the health plan and onto AllyHealth. Providing that guidance to the right care at the right time and supporting utilization management is what's going to save the county money. And I'm going to let some of our guest panelists talk a little bit about that as well. And you can keep going to the next there. Engagement and reporting. So this is where it comes back on us here at AllyHealth, is we want to make sure that we are proving this through utilization reporting. This is not something that's put in place as a new object and it's forgotten about. We are consistently and ongoing engaging county employees on an ongoing basis to make sure that they understand how, when, and why to use this benefit, so that ultimately we can prove that out in our utilization reporting, that we are redirecting costs, we are redirecting claims. We are so confident in our ability to drive that cost redirection, we actually will put in place a performance guarantee for your county. So this is a cost neutral clause in our contract that says for every dollar you're spending on providing AllyHealth, we're going to save you, or we credit you the difference. So we're happy to expand on that in a follow-up call, but it really is designed to be a cost neutral option for you guys, where we're going to deliver through that reporting claims redirection and cost savings. Now you can keep going through here. This is just a really great visual. I love this, where employees are going into the wrong door, right? For vast majority of sicknesses and illnesses, little minor accidents, injuries, cuts, bumps, bruises, going to the emergency care, urgent care, or seeking no care at all and letting it fester until they need to seek emergency care because they don't want to go the normal route. We want to change that mentality and have them use virtual urgent care, virtual mental health, primary care, et cetera, which is an appropriate path of care for a majority of non-emergencies. And I have one more slide here, and then we're going to get to our panelists here. I want to be clear on what AllyHealth is and what AllyHealth is not. We are a virtual front door to care. And by virtual, I mean 1-800 number, online, on a mobile app, We don't want to isolate anyone to using a mobile app. We know some folks that's not their preference. We have online access as well as a 1-800 number. So we want to make sure we're appealing to any and all employees, but it's a navigation support partner really with hands-on engagement to redirect that claim and support appropriate utilization on the health plan. AllyHealth is not an insurance product. We are not an insurance carrier. This is a health service whose main goal is to save counties on their bottom line. It is not a replacement for existing plans. It is not required to open up a plan year or make any changes. It is not something that's going to be plopped in your lap and forgotten about. This is a high touch, high engagement, white glove service that, you know, we have this wonderful partnership with NYSAC to make sure that you guys have the resources you need to be able to save on your bottom line. Now, I will make sure that everybody gets a copy of this, but I really would like to open it up to our guest panelists. And I'd love to just start this by asking a simple question. Why, and Alan, if you don't mind, I'm going to start with you here because you're the first video on my panel here. But why did your county in particular start looking at AllyHealth? Was it provider shortages, demand, you know, access challenges? What specifically drew you into the conversation?
So I'll start with, I mean, everyone looks at cost. Let's redirect those costs. But so truly, when we started with AllyHealth, our main mission was access. So Otsego County, upstate, rural New York, you know, very large square mileage. We have one hospital right here in Cooperstown, Bassett, and we have one hospital over in the only city in Otsego, Oneonta. All those outskirts, if you got to get to a hospital, you got a long way to go. So we were like, okay, we can get with AllyHealth. Someone has an issue, they can call first. And then if it's serious, just get them an ambulance, get them to the hospital versus them having to go out in the middle of the night and, you know, accidents, young kids, you don't want to drag them out if it's cold. That was our main reason for going. And it's been huge. You know, you can call right from your house and you don't have to worry about it. You can go right down to your pharmacy and pick up a prescription because they'll call right in. So, yeah, it looks like Caitlin's frozen. You frozen, Caitlin?
Okay, let me take it from here. So Scott, how did the, you know, based on what Alan mentioned in a rural setting, the same would be applicable in an urban setting where I live and work in Albany County. Talk about how the labor union looked at this when you got involved with this. Obviously, the state CSCA and its local chapters have endorsed this program, have utilized it. The employees are very happy. Tell us about the employee experience with this.
Absolutely. Thanks, Stephen. Yeah, I'm going to come at this a little bit different, right? So I'm going to focus really on my experience with Ally when I was director of health benefits. I'm also a fund administrator for CSCA Trust Fund, and I'm going to use sort of some of my health insurance, health benefits wear that consultant hat on as well. So from an employee standpoint, employees love it, number one, because it does remove all cost barriers to care. I can't even consider AllyHealth that first generation telemedicine program any longer. They've really evolved and made, you know, an entire health, wellness, and employee support platform. So I know Caitlin touched on it a little bit, but really the scope of the services now that are provided specifically through the AllyHealth model has grown dramatically, and employees love it. I want to talk a little bit, though, if you don't mind, Stephen, about really what differentiates AllyHealth from what your counties are receiving today, because I'm sure there's some folks on the call that are saying we already have telemedicine. It's embedded and integrated with our current health plan, right? And many counties are self-funded, but it doesn't matter whether you're self-funded or fully insured. Most health plans now have a telemedicine program embedded with their plan. But really what differentiates what you have today versus the AllyHealth model is really a few things. You know, mainly the engagement. What AllyHealth does to engage your employee population to understand what the benefit is and to make sure that they enroll and register into the program, in the program, and they utilize the program. You have that today, but I guarantee you, if any of your counties that are on the call today reached out to their consultant or broker and they asked what the utilization is right now with their telemedicine program through their carrier or third-party administrator, it's going to be a relatively low number. And why is that? Well, there's a couple factors. I've always found that most employees don't know what they don't know. They have no idea what their health plan includes. And that's where AllyHealth really differentiates themselves from the current carrier model. Remember, carriers or third-party administrators, they do a ton of things, and they do them well. They adjudicate the claims on behalf of the employers. They negotiate with the providers across the, in their provider network. They administer case management, care management, disease management. So they do a multitude of things, and they do them pretty well. Telemedicine happens to be one of them. The problem is when you focus on everything, you can't focus on one thing. And that's where AllyHealth sort of fills that gap. That you partner with a strategic vendor like AllyHealth to take that sort of book of business, if you will, or that component off the shoulders of the employers, and really off the shoulders of the carriers or third-party administrators. And their sole focus is really to drive engagement. And I'm sure you're going to hear more about that with some of the other panelists. But that's really the differentiator between AllyHealth and what counties are generally getting today. Number two, go ahead, Stephen. Yeah.
No, number two, go ahead.
Number two, and Caitlin kind of glossed over this, but this is a very important piece. This is not part of your health plan. It's a carved out additional benefit that employees receive. Whenever they utilize this program, no claims are adjudicated through the health plan. So not only is there no cost for the employees, right? Remove that cost barrier completely. Why wouldn't you use it, right, as a first line of defense, as Caitlin mentioned? But number two, again, another differentiator with what the carriers are offering today, there is no claim behind the scenes that gets adjudicated by your health plans. Today there is, right? If you have an integrated carrier or third-party administrator model, yes, they may offer it as zero copay, but every time an employee utilizes that program, there's a claim that gets adjudicated behind the scenes, albeit much smaller, obviously, than going to an emergency room or an urgent care, but the program itself has a cost to it. Now, that's a big deal. And if you know anything about cost containment or risk management of health care, you really want to drive these claims off of your plan completely. And yes, the current models do that to an extent, but there still is a claim, is what I'm trying to get at, versus the AllyHealth model where no copay and no claim. And couple that with the dramatic utilization that AllyHealth is able to drive through their engagement practices, it's really a win-win-win, I think, a scenario here. And that's why CSCA has endorsed AllyHealth in the past. That's why 13,000 participants under the trust fund have AllyHealth currently. And really, I'm retired now, so to be clear, but in my consulting business, I will certainly use AllyHealth as a preferred vendor because I've seen the results and I understand their model, and it does move the needle. So I'll shut up there, Stephen, and I'll hand it off to you.
Fantastic. Caitlin, back to you. What I did was ask Scott about how the employees, we had Alan talk about from the employer side of it, and then we just shifted and we asked Scott about how the employees view this, and you heard that discussion. Perhaps you want to bring Cecilia in now from the great county of Cattaraugus, talk about her experience. But I want to turn it back to you, Caitlin.
Yeah, that would be great, Cecilia, if you don't mind. I know that your name says also Caitlin, but Cecilia is with us here from Cat County. And I would love to hear from you. Like, have you gotten feedback from the employees? You know, what has been your experience with AllyHealth thus far? And by the way, Cattaraugus County has been with us since 2018. So they've been a long time client with us. Absolutely love working with you guys over there as well. So thank you for joining us.
Yeah, no problem. Thank you for asking me to be on the panel today to share our experiences. And to build off what Scott was talking about one of the benefits of this program not being associated with the health plan is that employees who are not on our health plan, who maybe have coverage somewhere else or are part-time employees, are able to utilize the service as well. So we're not limited to offering it just to employees who choose to participate in the county health plan. So it's a value added benefit for all of our full and part-time employees. And in our county, when we first were looking for telemedicine service, it was really driven by access. We're rural. We have one hospital as well. That is the only place you can get 24-hour access to care. We had limited urgent care at the time. Primary care doctors were struggling to keep people in our county, and that has improved some, and we do have a few more urgent care centers, but we still see our utilization of AllyHealth improving all the time. And we're able to get our reporting, and we get really good feedback from AllyHealth with where people would have gone and where we were able to save costs on the health plan if they would have utilized a higher level of care like an ER or an urgent care. But we also get really good feedback from employees who are able to go on the app at lunch and request a consultation and speak to a doctor in 15 minutes, or have used it on vacation traveling with their family if they're in a state where there's a physician and they had something come up where they needed to speak to a doctor. So we get great feedback from employees about the 24/7 access, the holidays, the weekends, the nights when doctors are not available. And this time of year in our county and everywhere, urgent care centers are packed. Cold and flu season. So if you can avoid going into one of those places with a child or with a family member, it's just totally improves everyone's experience with the healthcare system.
100%. Thank you. Cecilia, I want to just elaborate on something that you mentioned about the reporting, how it shows where the employee would have gone if they didn't use AllyHealth. So I just want to expand on that for a moment. So part of our detailed reporting, like I was talking about earlier, where you're getting that detailed utilization reporting, that really holds us accountable to making sure we're driving education. I know that, Cecilia, we've done on-site meetings and open enrollments and wellness fairs, same with you at Otsego County with Alan. The importance of that transparency in that at the end of a medical visit, we're asking the patient or the employee, where would you have gone if you did not have access to AllyHealth? And it gives them a multiple choice, ER, urgent care, primary care, delayed care, done nothing. We're reporting that back to the county specifically so they can say, wow, 14 people would have gone to urgent care. Our average cost for an urgent care claim is $1,100. It's saving us approximately X, or $200, whatever it is. So they're actually able to have insight into their dollar for dollar claims redirection. So it's really important. I thank you for bringing that up. And Scott, have you you've seen obviously our reporting, understanding that will show dollar for dollar, or I guess a dollar representation for those missed visits as well.
100%. Yeah, reporting is very important, right? Not only are you driving utilization and engagement, but you have to show, if I was a plan sponsor, I want to see from a dollar perspective exactly where the savings have come from. And again, your reporting is very clear on that and shows exactly what claim perspective. Sorry about that. Yeah.
Yeah. Alan, I'm gonna pull you back in here because you were the most recent visit I made as far as getting together, running some on-site meetings. From a leadership perspective, what impact has it had on your team? You're on mute, maybe, or I can't hear you.
Thank you, by the way. Sorry, I was on mute.
Yeah,
you did just come recently, but you've been here at least 10 times. I can't even count, but every time you come, we do presentations. We always fill the room because people want to hear what's new. We get anywhere between 30 and 40 people sign up. We have almost everyone everyone's signed up, but the registration process, because sometimes you have your older workers that struggle the registration process. Caitlin is there the entire time, walking every single one of them through the process. We'll sit there and make sure they're logged in. So everyone's excited to come to these because you've always got someone new, a new employee that's like, I don't really know what this is. This can't be true. There's no way I can do this for $0 and do this from my house. they come and they listen to other employees that are like, I thought the same thing, but it's actually true. So you get a lot of eye opening from that we've noticed anyway.
Yeah, and I mean, it always means more coming from their peers too. So I know in the past, what we've done is collected testimonials from employees that have used the service and been able to share that internally. So that's also helped a lot with making sure people understand that this is true and it is not too good to be true, and they can use it for those purposes. And I know, Cecilia, we've done a couple health benefit fairs, but just from your perspective in HR, I guess my goal of asking this question is I want to make sure whoever's on this webinar with us today understands that this is not meant to be an additional burden for HR. No, we have feeds set up. We make sure everything's automated. It is not, we try our best not to make this a lift for county staff.
Yeah, it's very minimal in terms of administration. The member portal that we keep track of our new employees in is very easy to use. And on top of that, you guys provide all the member communications that we send out. So periodically, every other month or so, we'll send out an email to all employees, or we send flyers out to different departments around our county to just put up a new fresh flyer to remind people of the service. Mm-hmm. We just did a cold and flu email blast 2 weeks ago to remind people of the service. So if they were looking for an alternative to the local urgent care or their doctor, or not doing anything, they were able to use the service. So we really, and then like you said, you guys come out annually when we have our employee benefit fairs during open enrollment. Mm-hmm. And we always get a great response. It's a nice way to put a face in front of employees and remind them that the service is available on an annual basis.
Yeah, and I know I specifically remember coming to your county because they really loved our swag. We got a lot of folks coming grabbing swag off the table. So thank you for having us out there. I know we're coming on 12:40, and I do just want to ask each of our panelists one more question, and it's really directed towards our attendees on the webinar today. But what advice would you guys each give another county considering this type of benefit? And Alan, we can start with you. We'll go to alphabetical order here.
Yeah, no, yeah. My one thing that I gotta say that AllyHealth has done for our employees and for anyone who's listening, whether you're in an upstate rural county or you're downstate, you're more urban, cost was huge. We have saved money. You can see that. You can see with the $0. But the biggest thing that we get back from our employees, and I always forward them to you, Caitlin, and I forward them to Amber so she can see them. Our employees love the peace of mind. You've got young kids. I have 3 young kids, and their ear hurts or your arm hurts. You can call AllyHealth, and they'll just be like, "Yep, it's a scratch," or they'll tell you like it's serious and you need to go to the hospital. And just having that peace of mind for employees was huge, which is why we get raving reviews all the time regarding it, because they just feel better in today's world where everyone's worried about their health, every little thing, all these ailments going around. They enjoy having that where they can just call with any little thing or any serious thing, and it's zero copay.
Yeah, having it as like a first line of defense. Like I said in the beginning, if it can wait 15 minutes, because that's the average response time, right? If it can wait 15 minutes, just call AllyHealth. 94% of our calls are resolved in that very first phone call. Now, they can have follow-up phone calls if they want. That's totally fine. They can request follow-ups, but 94% of the time they're resolved in that very first phone call. So we want to get people, and this is why we do so much on-site. We want to get them in the habit of, hey, this can wait. It's not an absolute emergency. Let me just call AllyHealth, whether it's something super minor, or even if it's not like I have a sinus infection, I need an antibiotic. Even if it's just, I just want to talk to somebody. Like Alan mentioned, the peace of mind of just having a doctor right there for you to help you through things. But thank you, Alan. I appreciate it. Cecilia?
I would say just consider this as a value-added benefit for your employees. It's something that helps to kind of build morale to say, my employer is thinking about me and my family and trying to provide the best services for us. And get a ton of feedback from people who just really like that feedback is no cost without having to worry about a copay or having an appointment scheduled. And they also like the ease and convenience of the service where they use the is something we get feedback from all the time, that people enjoy the service and are seeing it as a value from their employer.
All right, Scott, I'll pass it to you. What advice would you give counties that are evaluating or thinking about evaluating having getting more information on AllyHealth, I'll say?
Well, I'm pretty matter of fact, and Stephen knows this, and Caitlin knows this. So my advice number one would be to contact you to really talk about the scope of the platform that's available to employer groups, right? Counties and specifically. And I do want to, if you don't mind, back up, because you were talking about the support that you provide the county groups continually throughout the year. And I want to be very clear, the support doesn't end when you sign a contract with AllyHealth. Right? They have a total 1 year sort of a timeline where they engage specifically on a continued basis, really is what, again, driving this engagement and utilization. And I'm saying this, I also have AllyHealth personally, so I'm not trying to talk about a car that I wouldn't drive, right? So I certainly, I understand this platform. And the other thing is, which I wanted to mention really quick, because a lot of employers now have high deductible health plans or high out-of-pocket cost sharing. Some employers, counties included, are now offering HRAs and HSAs to their employees. Again, because this program is detached from the health plan. If an employee, for example, has a high deductible health plan, the claim, they don't have to pay anything out of pocket. It's not part of the health plan. If a county provides a health reimbursement account, right, funding accounts on behalf of employees, anytime an employee utilizes the AllyHealth model, there is no claim, therefore saving those HRA dollars, which are owned by you, by the way, as the county. The counties own those accounts. So again, saving multiple savings opportunities here. So my advice would really be to schedule something with Caitlin, really, to talk about what the differentiators are with what they have today. Certainly if you're self-funded, but even if you're, all counties are large employers at this point, you're experience rated. So any claim redirection, any claim avoidance is a big deal for the plan from a savings perspective. And as the panelists have said, employees really, love this value added benefit. And again, all the barriers have been removed. And I know Suffolk County, I believe is on the call as well. I think this would be a perfect fit, because although we didn't represent Suffolk County, I do know they do administer a very large, sort of like a labor management self-funded program. And I think this is a layup, quite frankly. And I don't work for AllyHealth, so this is just free coming from Scott Futia. But so that's sort of my thoughts on that, Caitlin. But again, support doesn't end when you sign a contract, unlike a lot of vendors in this healthcare space. So again, thank you for having me.
Yeah, thank you, Scott. And look, every county is going to be at a different stage. There's not a one-size-fits-all approach with AllyHealth. We have a variety of services. We have, a variety of plan designs. The value of conversations like this, learning from peers that are navigating the same, realities and constraints. So I would just say, as we wrap up, thank you so much to the panelists who were sharing their experiences so openly. I think we heard some common themes. Access matters, employees engage when benefits are easy to use and convenient and affordable, and really having the right support in place is going to help your teams manage the employee needs and manage costs more effectively. So I would just ask, if today's conversations or discussion sparked questions, curiosity, exploration calls is probably a really healthy next step. I know you're going to be receiving information on how to connect in a follow-up email, but we do have a dedicated email for our NYSAC partnership, and it is simply nysac@allyhealth.net. So we'll make sure to get that out to you. Thank you again to NYSAC and everyone who joined us. I hope this conversation was informative and useful, but I would like to pass the mic back to Steve for any closing remarks, and thank you so much for having us.
Okay, absolutely terrific discussion, very intriguing. Encourage our members to submit questions right now. We do have a few questions in there, so if folks have questions, we can take them now. I'll start with pulling up a couple here. We have a few minutes. We have about 8 minutes on time left here before the hour is up. First question is there an open enrollment? Carriers typically have an open enrollment for switching plans and so on and so forth. Caitlin, I'll direct these questions to you and then you can assign them to the various panelists. So the question is is there an open enrollment period?
So not technically, no. So since we are a health service and really a partner product, there's not a need for an open enrollment period. Do we like to be able to educate, onboard, engage, do Zoom meetings, do on-site meetings? Absolutely. But it's not a technically an open enrollment. In fact, most of our enrollment or kickoffs start off cycle. The reason why we like to do that is because we don't want it to be clouded in the message with everything else to do with health insurance, right? You got copays, you got deductibles, you can pick this plan, that plan. Here's all the 18 other line items you got to pay attention to. When AllyHealth is launched separate, we do tend to see much higher engagement because it's, hey, we know you guys have this problem. Here's a solution. And in my opinion, healthcare issues don't wait for open enrollment, and neither should solutions. So we really are able to be flexible. We can accommodate like a short plan year and then renew the contract year during open enrollment, but we do not have a technical open enrollment. I don't know if there's anything anybody else wants to add there, but hope that answers the question.
Okay, seeing everyone agreeing with that answer, we'll move on to the second question that we have here. Is this program an employee monthly paid benefit, or is it an employer paid benefit? I've seen it both ways. I've seen the situation where an employer sets aside a certain amount of money to do this because they obviously see the savings in this, and perhaps we could I'll again turn that question to you, Caitlin, and then you can work with the panelists on the response to that.
Yeah, I mean, all the folks on the call today, Alan and Cecilia, their counties do provide the benefit as a county provided benefit. Sometimes it's for only those that are on the health insurance. Sometimes, like in Cecilia's case, it's for any and all eligible employees, including part-timers, et cetera. There are some times where we do it as an employee funded benefit through payroll deduction. We of course make exceptions for that, but over 90% of our county business across the country is county funded. Scott, I don't know if you want to add anything there from what you've seen, across your relationships with counties as well, but.
I kind of do, because you're going to ask the union guy if it should be an employer paid benefit or an employee paid benefit. But,
nice.
Yeah.
Being nice, no, but it makes sense. No, Caitlin's correct. So yeah, I would, like Caitlin said, most of their book of business is employer funded, right?
Yeah.
And I don't know the fee schedule or arrangement, but I'm going to guess it's on a per employee per month basis, at a very low rate. And again, because of their focus on driving utilization, the savings far outweigh the PEPM, I think, fee structure. And I think they, quite frankly, may guarantee that, to some extent, right? So, yeah, I mean, every group that I have seen it's funded solely by the employer.
Yeah, I think for our other panelists, it was a no-brainer for you guys as well to include it into your suite of benefits, not only for the convenience, accessibility, but the affordability, and then with the cost savings just as an extra, it's an extra perk. If we can cover the cost for it and do a great service to our staff, then it's a win-win. But we do have multiple funding options. So long story long, we can accommodate both funding options. It's just whatever is best for yourself and your county. So we can absolutely discuss that in a follow-up meeting as well.
Okay, thank you for that. We have a couple more questions here. Again, if the members have questions, we have a few more minutes. You could submit them into the question tab on your bar. The next question here is dealing with can you further explain if the carrier or the county has a telemedicine plan in place right now, how is this different? And I think Alan mentioned that a little bit when he was talking about the impact to an existing telemedicine plan. And I think you mentioned that too, Caitlin, in that if it's an existing plan, it might tend to hit the carrier or the cost to that.
Yeah.
Can you explain that?
Yeah, so there are a couple major differences between what's going to be embedded in a carrier plan and what AllyHealth provides. But before I go into some of those nuances, it's important to know that 100% of our fully insured clients typically have some sort of telehealth built into their plan. They also have AllyHealth. Here's the question you want to consider. Is claims redirection important? If claims redirection is important, whether it's us or anybody else, having a $0 copay, high touch, high engagement telehealth plan is super important, because what we're focusing on is redirecting those claims off the health plan and onto our third-party platform. Now, the carrier embedded plan is always going to count as a claim on the health plan. Oftentimes, as if they were to walk into the doctor's office, it's the same claim that attaches to the health plan. It also only covers those on the health plan, right? So if we have kids on Child Health Plus, you have kids on a spouse's plan, the carrier plan is not going to extend coverage to the household. Whereas I know Cecilia mentioned that it was important for Cattaraugus to extend household coverage and family coverage and let their county employees know that it's important for everyone to be included in this and have coverage. So it's eligible, ours is eligible to all household members. It's not isolated to those covered on the health plan. So utilization, coverage, also just the variety of services. So our services really focus around urgent care, primary care, physical therapy, dermatology, mental health counseling, either short-term or long-term, even a wellness program. We have a variety of services, all of which do not count as a claim on the health plan. You also want to consider transparent reporting, utilization, account management, having that dedicated account management in for open enrollment meetings, wellness fairs, et cetera. So really having more of a hands-on approach. But the biggest thing is going to be utilization. If utilization and redirecting claims is important to your county, it is important to consider a third-party telehealth vendor, period. I don't know if there's anything else you guys want to add to that, but.
Okay, seeing folks agreeing with that, our panelists. I have 2 more questions in the queue here. Again,
Sure.
If folks have more questions, please submit them. If we can't answer them today, we can get them out to you and to all the attendees at a later date. The next question is dealing with what professional networks of providers are applied here. How does is it applicable to all counties in New York State? I guess we can sort of expand that question. Is it for all New York counties? And then how do you get the professionals, the network?
Yeah, so good question. Keep in mind, these are virtual care providers, right? However, they are all New York State licensed providers. So commonly they are emergency room, GPs, PCPs, right? So we also have those specialists, but they are going to be all US board certified state licensed providers. Now, I'll give you a couple of examples. My mom happens to love this guy, Dr. Minkus out of Buffalo. She will wait to speak to him. They have a great patient-doctor relationship, even though it's a virtual provider. So they are oftentimes located in New York State, but they can be, sometimes you'll see somebody that lives in Bennington, Vermont, but is licensed to practice medicine in New York State. So they have to be US board certified state licensed providers. We currently have a network of over 6,000 providers nationwide, because it's not just available in New York State. But if you're calling from New York State, you are going to be and have to be connected with a US board certified New York State licensed provider for them to be able to prescribe medication in New York State. Now, the way we monitor volume, callback time, making sure we have enough providers is by callback time. Our desire is to have our callback time under that 15 minutes. If we see that callback time is getting higher on average, we cross-license or onboard additional providers to be able to service our New York State clients. But we do have a ton of clients in New York State, being that I live in Albany, and I haven't had a callback time over 4 minutes, but our average is under 15.
Okay, we have another 2 questions here. How long has Cattaraugus and Otsego been with AllyHealth?
So, Alan, correct me if I'm wrong, but I feel like you guys were early 2020s, I want to say, maybe 2022.
I thought we were a little even before that. to be
Before
honest.
that, okay.
I know
Maybe
I've been here
2020.
since 2016. I started as a treasurer 2018. I want to say it was right around that time. So
It might have been actually, yeah, because
Wow.
Cataracts was 2018. You guys, Cecilia, you guys started with us in 2018. I do know that. Yeah, Alan, you guys probably weren't far after that. So
Okay.
Yeah,
what's
I
that
think it
now?
was-
8 years?
yeah,
Seagull's pre-COVID.
yeah,
Okay.
we were pre-COVID. I remember talking with Scott before that. So yeah.
Yeah, I love how we categorize everything now as pre-COVID, post-COVID. But yeah, that's true. Now that I recall, because I remember coming out there pre-COVID. So let's say 2018 for both.
Okay, and then the last question that I have that has come in is how do the existing TPAs or carriers feel about this? Obviously, this is a program that can really help an entity who is self-insured for
Yeah.
its health insurance. But how do the TPAs or health insurance carriers feel about this type of a program?
In my experience, they love us because we're saving their clients money and they're going to retain the county as a client because they're happy with their services, right? So in my experience, I've had nothing but great relationships with CDPHP, MVP, Anthem, Empire, the Blues. We've had great relationships with them over the years because in essence, we are taking those unnecessary costs and redirecting them off the health plan, not extending their exposure, and they have happier clients because of it. TPAs, same thing, right? They're not, we don't coordinate benefits with the carrier. We don't coordinate benefits with a TPA. We don't coordinate benefits with any other health benefit. We're a standalone and purposefully so, right? Because we want to take those claims off the plan. So the TPA is just going to be administering or seeing less claims come through because they're coming through AllyHealth. They're not going through the health insurance. And I don't know if I'm explaining that correctly, but if there's anything else anybody wants to add there, but we've had great feedback from brokers, from TPAs, from carriers. We have great relationships across the state.
I just want to jump in and just say that we have health insurance meetings once a year, and we have Excelis, USIR TPA, we have AllyHealth. We're a big team. There is no like, oh, well, this, like, everyone sees we're a big team and we all work together. So it's very helpful and they all get along very well.
Yeah.
Okay, that is a wrap. That's all the questions that we have in the queue. I want to thank our panelists, Scott Putia, the former Director of Member Benefits at CSCA. Thank Alan Ruffles, the Otsego County Treasurer, Cecilia Schwinnard, the Cattaraugus County Human Resources Director, and of course, Caitlin Herwig from AllyHealth. Fantastic discussion. You can submit your questions, comments, concerns to that email right on that screen there, NYSAC@allyhealth.net.
Yes.
Thanks so much, everyone, and have a great day.
Thank you so much.